Hello, everyone. It's September the 25th, Friday. We got a lot to report, and we'll go through it as quickly as we possibly can. You know, in the most respectful way, I always want to start with this. We have now lost an additional 11 people in West Virginia. We're up to 330 deaths in West Virginia. That's not good. You know, our 320th death is a 96-year-old female from Mason County. 96 wonderful years. Our 321st death is a 62-year-old female from Fayette County. Our 322nd death, a 72-year-old male from Fayette County. Our 323rd death, an 86-year-old male from Kanawha County. Our 324th death, a 69-year-old female from Kanawha County. Our 325th death, an 89-year-old male from Pleasants County. Our 326th death, a 67-year-old female from Kanawha County. Our 327th death, a 69-year-old female from Kanawha County. Our 328th death, a 94-year-old male from Harrison County. Our 329th death, a 58-year-old male, a very young man from Doddridge County. Our 330th death, a 67-year-old female from Mercer County. You know, I don't want it to ever fall on deaf ears. Please keep these people in your thoughts and prayers. They're not statistics. They're not numbers. They're people. They're our families. And they're great West Virginians. So please, please join Kathy and I in absolutely our most sincere prayers for all these people. And know we're all on our way to try in every way we possibly can to rid ourselves of this terrible pandemic, and we're going to get there. Although the skies may look a little dark, we're going to get there. From our numbers standpoint, we have had 247 new positive cases in the last 24 hours. That's probably up from the standpoint that we're testing more, which is really good. Our positivity rate, the daily positivity rate is 3.53%, and our cumulative positive rate is 2.79. We have 3,655 active cases and right at 11,000 recovered cases. We have 177 people that are hospitalized at this time, and our reproduction RT rate is at 1.03. It's the same as it was on Wednesday. It's really pretty good, to tell you the truth, and we're right in the middle of the pack. We have the 26th highest in the country, so we're right in the middle of the pack as far as the states. We want to absolutely get this rate down to where we end up with the lowest rate in the country, and we can do that. Now, from the standpoint of our testing, we have really amped that up. We have created through the National Guard an additional 15 teams to test our schools, nursing homes, prisons, you know, anybody and everybody. You know, this more than doubles the teams that we've had on the ground to be able to do testing. And so, you know, that's great news to me, because I truly believe the more we test, the more we'll learn. We absolutely cannot possibly get at the root of all the problems until we know what the problems are, and we can't help people until we know where the problems are. This gives us a much more surgical approach to be able to find the problems and then help the problems and cure the problems. You know, from the standpoint of recurring or the reoccurring free testing that's going on all over the place, and so, you know, there's no point in me going through every bit of that. From the standpoint of where we are today, we're in Cabell, Fayette, Kanawha, Logan, Nicholas, Wayne, and Wyoming counties. On Saturday, we'll be in Jackson County. Next week, we'll be in Cabell, Taylor, Fayette, Logan, Mon County, Wayne County, Marion County, and Jefferson County. We'll probably be in Kanawha County as well. You know, I encourage everyone, whether you're a young school-age child, you know, whether you're a person that is quite elderly, you know, whether you're anybody in between that has any anxiety level or just feels like it's really good to go get a test because it just may be you. It just may absolutely be you that is an issue where you could be giving this to other people and don't even know it. So please, please take advantage of all this testing. It's painless. It's absolutely real quick. It doesn't cost you one dime, but it does give us the ability to find out more and more information to be able to stop this. For as far as the flu vaccine, you know, it's, you know, I would highly encourage, in fact, I think they're going to get me on that one too sometime next week, but I haven't had my flu shot yet, but I'm going to get it really, really soon in the next few days. And I get my flu shots every year, and as does Kathy and my family, and so I highly encourage you to follow up on your flu shot and do that, please. From the standpoint of our mapping, I want to just hold this up and show you that this looks one whale of a lot better to me. That's all there is to it. So we're making real headway somewhere at least and everything. And so in this mapping right now, we have 4 counties in the orange and 4 counties in the gold. And lo and behold, look, you know, I want to super congratulate Mon County. I mean, look at Mon County. They have been right here, and they have been red, 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 red. They have dropped all the way to the yellow. That is fantastic beyond belief. And it's the same in Putnam County. You know, from the standpoint of Putnam, you know, they were red and everything. They've dropped all the way to yellow. That's great stuff. Way to go, way to go, way to go. And now, if I could jump over to the long-term care facilities, you know, we have 36 outbreaks in our long-term care facilities. You know, in our churches, we have 4 active outbreaks now in Harrison, Nicholas, Fayette, and Kanawha counties. Again, I keep congratulating and urging every single person, you know, that is planning to go to church or going to church on a regular basis to social distance, keep the pews in between. Please wear your mask. Please, please wear your mask. You know, this is an invisible killer, and it just doesn't seem like it's possible in a lot of ways, but boy, when it jumps on you, it turns into bad stuff. You know, you can't imagine. I want to tell you just this. You can't imagine the number of calls that I get, and people that call sometimes are people that say something like, you know, I would have been one that would have said, I'm not wearing a mask, and I'm really an advocate of the fact that, well, you know, by God, that's my right and everything, and I'm not wearing a mask. And then all of a sudden, you know, you get a call from somebody and they say, Governor, you know, I've got COVID, and I am just hanging on, praying for my life. And so maybe I wasn't right, but I can tell you this is serious stuff. So please keep all those people in your prayers as well, because maybe if they had worn a mask, maybe it wouldn't have happened, but at the same time, maybe it would have, you know. And so, but irregardless, we want to always do just this. We're West Virginians first and foremost. Every last one of us in our lives makes plenty of mistakes. And we have a lot of regrets as we go forward, and a lot of questions and doubts and everything else. But as we do that, what in the world does the good Lord above teach us? He teaches us to love one another. He teaches us to keep moving forward. He knows we're going to make mistakes. And so continue to love. That's what we really need to do. From the standpoint of corrections, the corrections update, we're down to just 4 positive inmates now at Mount Olive. We have 13 active staff cases, 9 of which are at Mount Olive, but we've made giant progress there. From the standpoint of our small business grants, we're up to 21 million that we've got, awarded, and that's 7,700 applications. That's much better. We're just under 120 million. It's gone out to 191 cities and counties. Can't be any better. We were just given $10.3 million, from the US EDA. And they gave that for us to be able to give revolving loans to our small businesses to encourage them, especially those that have been really hurt with this COVID situation, to be able to get them through some way, somehow, through our EDA. And so I would tell everyone that the dollars are available, and if you'd contact our state EDA and Mike Graney and the whole team over there at Commerce, Secretary Gaunch and everybody will assist you and help you. In all of that, the fellow that was doing all the presentation and everything from the federal government, side and basically awarding us and giving us the monies today, a really good man and everything. But one of the things he spoke on was the fact that he said, naturally his boss is Wilbur Ross, who's the Secretary of Commerce. And the Secretary of Commerce is the one that heads up the census. And so therefore he's saying, as I'm sure he says everywhere he goes, state to state, he's got almost, maybe some level of a pat speech. And he says, I want to encourage all West Virginians to be counted in the census because, you need to get your numbers up and you need to do this and everything, and because it will be terribly beneficial to you for the next 10 years to come. And then I spoke after that, and I proudly said, West Virginians, have surely listened to me in these briefings, and now we are at 99.9%, and we are now in first place in front of Idaho. Idaho is at 99.8, so you got them, West Virginia. Way to go. Really proud of you. And so that's just another step of just showing how great West Virginia is. And believe me, West Virginia, so many. I think the last go round, the total count in West Virginia was somewhere around 60%. I'm not sure if that's exactly right. I'm looking for somebody to tell me, yeah, that was right. But I think it was somewhere around 60%. Can you imagine the money we left on the table? But we're not going to leave any money on the table this time for 10 years to come. So way to go, West Virginia. Great, great, great work. I think Dr. Marsh is going to talk about our map, as we put it up here in just one second. From the standpoint of school outbreaks, we have, as I promised you on Wednesday today, I have an update on reporting of school outbreaks. And beginning today, the Department of Ed will post on their website a list of schools that have outbreaks of COVID-19. An outbreak is 2 or more cases in a school that are connected to each other. Now that's really important that you know that, from the standpoint that an outbreak is classified as 2 or more in a school that are connected together. The DHHR, the Department of Ed, are working with the local county boards of education to get this data, and that's how the data's got to flow up. And Superintendent Birch is with us today to talk more about that. And I guess we'll pass to him. You want to do that now, or let me go? I'll go ahead and get through. Okay. And so nevertheless, it's important to remember that the data will be delayed by a day or two before we can get it from the county superintendents and get it up. But it's up right now, and we'll go from there. In regard to our golf teams throughout our state, teams that are in the orange counties on tomorrow's school map may participate. The state golf tournament is now coming up. This is like a state high school basketball tournament, or the state football tournament and everything. But we don't want those kids to be ineligible, to play in their state high school tournament. So any teams that are in the orange on tomorrow's school map may participate in the state golf tournament regionals if the coaches and the players are willing to get tested before they play. Now, this recommendation came to me through the SSAC and the Department of Ed. It was discussed and everything and vetted as best we possibly can. I agree that this is the way to go. A golf team only has 4 players. They're surely social distanced way, way, way apart out on the golf course and everything. And it just so happens, if we have a team with 4 players that aren't really interacting together at all and everything, if we can get them tested and the coach, I think that's the fair and right thing to do. Now, I've got some really sad news here to report, that the Salem Fire Department Chief, Rick Todd, passed away this week due to COVID. And, one of our leaders as far as our first responders. I don't know what can you say to a family? I mean, what in the world can you say? This was a hero, as all of our first responders are, but not only a hero, but a leader of the heroes. So please keep this great man in your thoughts and prayers, and we thank him for his contribution to this state and all the great people of our state so many times. And God bless you, Rick, in every way. That's not good. Well, let me jump to Logan here just a second. We had a situation in Logan County that was interesting, and again, out of fairness, it came to the Department of Ed and it came to the SSAC. It's now found its way to me, and upon their recommendations and everything, I feel like that it's the right thing to do. That situation was just this: Logan County was in the gold. Well, when they're in the gold, they can go to school and they can play extracurricular, they can play competition within the gold counties. They're good to go. Now, but the Board of Education decided not to go to in-person instruction this week, and I don't know exactly all the particulars to that, but it may very well have been that they needed extra time to get everything just in place as far as going to in-school, instruction. From the standpoint of the kids that have been working hard and everything, and I'm surely a coach, I get all that, and been really working hard, to look forward to this opportunity and this day. They became gold. They did great work in the county to get there and everything. I see no reason whatsoever that we ought not be able to allow those kids to play their extracurricular activities and everything, and and very hopefully we'll be back in school there as well. But so nevertheless, upon the recommendation of the Department of Ed and the SSAC, they made the recommendation to me to allow these kids to be able to play, and I am all for it. So we're going to let them play. Now, I guess the last thing that I've got is just this, and I kept it for last because it is, again, West Virginia, and West Virginia just doing it, and absolutely this is the good stuff. West Virginia's personal income growth rate in the second quarter of 2020 is the second highest personal income growth rate in the nation. It just came out. I could not possibly be happier about anything at this moment with all the tough news that we have, but the personal income growth rate in West Virginia just came out for the second quarter of 2020, and our personal income growth rate is the second highest in the nation. Now, we all get that there's still lots of people out there that are hurting. And we all get that there's a lot of people that are wondering if my job is going to come back. And we all get that we got to continue to flip rocks and do any and everything we can to get everybody on this boat that is going north and full steam ahead. I couldn't be happier about being ranked second in the nation. The only way I could be happier is to be first, but at the same time, I want everybody to know we're not going to quit digging until every single person that's out there is hurting that we help them. So God bless everybody, and let's just keep at it, West Virginia. You're doing good in so many ways, but we still got a lot of people out there that we need to help. That's all I got, Jordan.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, and it's great to be with everybody today. I wanted to spend the time that I have to make comments on explaining the process that we're going through for the different color coding for both the public health map, which is published by DHHR on a daily basis, and our school map. So as we have talked at some length, we have adopted two different methodologies, two metrics that we want to use to make sure that we are fairly assessing the public health spread of COVID-19 in each one of our counties. And as we talked about early in the COVID pandemic, that we wanted to go from a state strategy where we are trying to treat each county as just part of a big state of West Virginia, which was that sort of suppression phase, the hammer phase. And then we wanted to move to a more precise phase where we looked at each county more independently as 55 parts of a whole and start to assess the COVID spread in each county so that we could make a fair assessment about the risk of opening of businesses and schools and activities, et cetera. And as we started, we used an infection rate, which basically just detailed how many new cases of COVID did we have on a daily basis over a 7 or 14-day period of time. And I'll talk about whether we use the 7 or the 14. And then we corrected that for the size of the county by having everything start to go back up by mathematics to 100,000 population. So every county was judged on a standard population of 100,000, which means on the small counties, you multiplied the populations to get to 100,000. And on the larger counties, we divided sometimes the counties like Kanawha County or Mon County to be able to get down to 100,000. And that is a very well accepted metric. And we created the 5 color codes to reflect a low rate of COVID spread, which is 0 to 3 cases per 100,000 population, a low moderate, which was the yellow color, which is 3 to 10 cases per 100,000 population, a gold color, where we used a metric of 10 to 15 cases per 100,000 population, the orange color, which is 15 to 25 cases per 100,000 population, and then the red color, which is over 25 cases per 100,000 population. And for most counties in West Virginia, and for any county greater than 16,000 people, we used the 7-day rolling average. And the reason why we did that, again, just as a reminder, is because we looked at those outlier counties, those really small counties, because West Virginia is really kind of unique in the country in many states, is we have very low population counties. And those county populations less than 16,000 were 2 standard deviations away from the median county, the middle population county. And so by mathematics and by statistics, that is a valid thing to do. And we separated those out. And those counties get a 14-day rolling average so that we gather more cumulative cases, because we know from public health perspectives that you really need at least a total of 20 cumulative cases to make accurate and reproducible assessments of those counties. So just to really quickly review that, we have an infection rate that really looks at how many new cases do we have per day, on a 7, or for the smaller counties, a 14-day rolling average, and then we correct those populations all up to 100,000 or down to 100,000 so it's equal. The problem with doing that alone, though, as the governor really recognized and challenged us, was that, in fact, what was happening is people understood that because we didn't account for how many tests were taken to get to that daily positive rate, that a lot of people figured out, well, if we get tested and we're positive, we're going to hurt our numbers. And so the testing started to go down and down and down. And so we recognized that one of the real cornerstones, one of the most important factors in controlling COVID spread is doing a lot of testing. So we needed to try to solve the problem about how we really incentivize testing and start to identify those pre-symptomatic, those people that don't know that they're infected, that can infect so many others. As we talked the other day, 8.9% of people infected with COVID infect 80% of everybody else. And the only way we identify them, because many of them are not even symptomatic, they don't know they have COVID, is test, test, test. And so what we did is then we came up with a second way to assess each county, the percent positive rate. And the percent positive rate is really just the relationship between how many positive tests do we have over 7-day averages for all the counties over 16,000, or for the counties less than 16,000 over a 14-day average. How many positive tests per day versus how many total tests did we do on that day? And as we've said, we really want to get that number up to 7,000, 8,000. Yesterday on the DHHR website, we were over 6,000, fantastic. And what we did is then we looked at the public health literature, and we figured out, and I'll talk about the CDC's guidelines, which then came out afterwards, after we did this, which really reflects the same thing, that if we are under 8%, between 5 and 8% on the CDC's map and public health, that is a moderate risk of transmission when you look at opening schools, et cetera. But we decided, because we wanted to be really, really careful, that we were going to take that down even more. And we were going to say under 5% rate of transmission, which is recommended by many governing bodies like the World Health Organization, et cetera, that we were going to get the counties into the gold color. And if you're below 4%, you would then be in the yellow color. And if you're below 3%, you'd be in the green color. And the one piece that we didn't really think about that we are adding based on CDC's suggestion is we never made a relationship between the red and the orange color, and that color really should be 8%. So what we now are putting into action is if a county is over 8% of that positivity rate in that interval, again, 7-day interval for counties over 16,000 population, 14-day interval for counties less than 16,000 population, same as we're doing with the infection rate. If you're over 8%, then you stay red. If you're between 5 and 8%, you would be orange. If you're under 5%, but greater than 4%, you would be gold. If you're less than 4%, but greater than 3%, you would be yellow. And if you're less than 3%, you would be green. And so by doing that, we are able to use that metric as well. And that metric really does incentivize testing, because we want people to test more and more, because the key is testing in itself is a mitigation strategy, because we really very desperately want to identify those people that can spread to other people who are asymptomatic. And so that is how we are getting to the color coding on the public health map daily and then on the school map. The only difference between the public health map and the school map that we're doing to make extra careful that we have everything right for the school map is we are stopping the collection of data on Thursday night, Friday, we're spending, our DHHR colleagues and epidemiologists are spending Friday checking every bit of data with the local health departments to make sure that all the congregate data is separated from the community spread data, that any duplicates are taken out, and that we are identifying correctly both the places of origin for where the person is, which county a positive test and a negative test should be counted in. And secondarily, we're looking to make sure from an epidemiology standpoint that everybody who's been infected, that we're correctly identifying those people who recovered versus those people that are still actively sick. And then, and that's all day Friday. And then that data is put together. Then on Saturday, we're having the public health panel meet to look at how the data is applied to make sure it's all being applied correctly based on the rules that I told you. And then a recommendation is made to the governor, and then the map for that week is posted. And lastly, I would just say, again, as a reminder, that the map that goes up on the Department of Education website will be standing and be the active map for the entire next week, except if a county goes into red. If a county goes into red, that change will be made right away. And as we have said before, whichever metric, whether it's the infection rate or the percent positive rate, whichever of those two metrics is better, will be the metric that's applied for the color code of the county. So I think by doing this, we're really starting to see benefits in the testings picking up. We're starting to see some of the infection rates go down, which is really, really important and exciting. And we know that when we start doing a lot more testing, we may see that infection rate, because it doesn't account for how many tests we're taking, go up transiently. But that's not bad at all, because that means we're starting to identify more people who are infected. And we believe that then will lead us to seeing both the infection rate and the percent positive rate go down, which is what we want, because ultimately, as we've said, the best predictor of safe schools and safe businesses and safe activities for each person in our state is low spread of COVID in that community. So I hope that helped. I know that was a lot to say, but we are very excited, and we feel very much that this metric, as the governor said in the last press briefing, really does start to get us where we want to be. And in fact, it's really very much consistent with what the CDC, Centers for Disease Control, has put out, except our map is a bit more rigorous than theirs. But that's because we want to be extra careful with the health of the people in West Virginia. So thank you so much.
All right, thank you, Dr. Marsh. Next to West Virginia Superintendent of Schools, Clayton Birch.
Thank you, Jordan. Dr. Marsh, thank you very much for that explanation. I know that I don't think many of us can hear it enough. I was going to ask you to repeat the whole thing, but the governor said that's not a good idea. It is actually really, really important that we do allow that process to happen the way it's done. We get that map on Saturday, and I've continually told the superintendents, the teachers, the parents, that one map that gets posted on Saturday is indeed a map that has been scrutinized, it's been scrubbed, it is a map we can trust to be the best health map we're going to put up to make those decisions. So I do appreciate all the work the health panels and the governor does in about a 48-hour period to make that happen. So a couple updates today. Listening to the press conference on Wednesday, wanted to give a very brief update on school nurses. I know that the governor received a few questions on school nurses, and I thought it would be really important. We have a brand new school nurse coordinator at the state of West Virginia. She comes to us from, I believe, Harrison County. Her name's Carol Ward. She is just one of the best advocates I have seen for school nursing, and we are so glad to have her. So she was paying attention and quickly got some information to me. And she wanted me to relay that right now, the state of West Virginia has about 450 school nurses employed. I wish they could all be RNs, but we know we're under a bit of a shortage. So that includes RNs, LPNs, folks that meet a variety of categories. Now, 450 is pretty good. However, I think everybody who has been around for several years will know that's not enough. And thanks to the governor and our legislative body, House Bill 206 passed. And what that did is that pumped about $24 to $30 million into our school system to hire additional support staff. And under that definition, that includes nurses. So total support staff prior to House Bill 206 last year, we had about enough money to hire about 186 support staff. Because of that bill, we now have dollars to hire 1,300. That's almost 500 additional people we can hire. But we're going to do everything we can to keep pushing to get more and more school nurses. I know that school nurses cover sometimes multiple schools. That is very difficult, especially when you're dealing with a health issue, and we're going to continue, Governor, to do everything we can to push getting more and more school nurses into our system. But I do think it was important for us to update that we are aware of that, we track it, and it is very, very important to the Department of Education as we move forward. I also want to again thank the National Guard. They have wrapped up last week their deliveries of some emergency packets to all of our school nurses across the entire state. Those include gowns and masks and gloves, and thank the National Guard for all they've done to get those delivered. And then finally, when it comes to PPE and continuing to track that, we have gotten pictures from our schools out in the state where Highmark packages are beginning to make their way into the classroom. We're about 2 to 3 weeks in school, so great timing, and thank you, Highmark, again, and the governor for getting that much material out there. Finally, real quick about the outbreaks. Right now on the public Department of Education site, we have the outbreak in public schools that the governor discussed earlier. We will every day get a list from Dr. Amjad and DHHR to be able to post the outbreaks that are active, the schools, the number of cases, and we're even going to post if that outbreak led to the school going to remote learning. Sometimes an outbreak might go to remote learning for an individual classroom, or it could impact the entire school. We also want to let you know we're going to continue to work with DHHR, the governor's office, and our county superintendents to also begin looking at how we can track and post ongoing cases. I think when folks see this map, they may say, well, wait a second, we have a school that I know is closed or impacted by COVID that's not listed here. And as the governor discussed earlier, it may not meet the definition of an outbreak. And because of tracing and investigations that are ongoing, it could impact a school. So I've asked Secretary Crouch and Dr. Amjad to briefly describe the process that we're going to follow to make sure these outbreaks get reported very clearly, and then the difference between the outbreak and the cases. So I think I will turn it over to Secretary Crouch at this time.
We'll have Dr. Amjad talk about that a little bit.
Sure. Yeah. Good morning. Thank you, Clayton. But as the governor mentioned, all the information and for the outbreaks for the schools will be on the West Virginia Department of Education website, and it's going to be nicely placed there for everyone to refer to each morning. That information is provided by DHHR to the Department of Education to be housed on one website so that it can be found there easily for everyone to see. It is difficult for cases to be reported because it's such a ongoing investigation by local health departments and the local health officers, as well as the school system. That information is coming at us very quickly, and because it's a single case, and I'll explain the definition in a second, that information is still ongoing, that we can't house that information on one website. We are working on a way to get that information. We do realize it will be informative at some point for people to want to see that. That is a nationwide call to action, I would say. But right now, our outbreaks are what we have in real data that we can put on a website. And we will be giving that to the West Virginia Department of Education on a daily basis for them to put here, which is a nice form that the Department of Education has put on. For the cases, as we mentioned, those are single cases. Those are being reported on a local level by the department locally to the school boards, to the families and the parents, as well as local journalists. You might go to their local websites or their local their their information, they do that daily on their newspapers. So they are informed at a local level of a school case. However, outbreaks, as the governor mentioned earlier, are 2 cases that are linked on a 14-day epi-linked data that is by a CDC definition. So those things are mentioned here on the Department of Education. So you can see that daily, and we are providing that to the Department of Education, as Clayton mentioned. But I would go to this website on a daily basis to see the outbreaks for the schools. Thank you.
All right, thank you all. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor pointed out, we have increased significantly our ability to support DHHR, local health departments with testing, regular basis, as well as quick reaction testing. We'll continue to work to support DHHR as we develop additional ways to get more community-based testing and more accessible manners out to the population to drive the effort that the governor has directed us to, which is to get those testing numbers up, as Dr. Marsh points out, to address and identify those spreaders and to reduce and mitigate the spread in our communities. 17 of 20 Wi-Fi sites are now up and running in support of the Department of Education efforts. You can see the additional sites that are coming online. If anyone needs assistance with that, please reach out to the National Guard or through the Department of Education for support related to those sites. I want to report that PPE in the state of West Virginia continues to stay at a good, solid, green, steady state level. Both our emergency supply, as well as we continue to track hospitals, long-term care facilities. We continue to address where there are shortages or reduction in supplies that need to be addressed. Disinfection missions continue significantly throughout the state, continuing to address that spread as well. Last 2 things I'd leave you with is you look at the statistics, particularly related to the death rates in West Virginia. The first 100 deaths in our state, unfortunately, were 110 days. The second 100, we reached that number in 41 days. The third 100, we reached in 22 days. And we are on track right now to reach the 400 in less than 22 days. I make that statement along with recognizing that this weekend would have been our Gold Star Family Weekend Retreat, that the National Guard has supported our Gold Star families over the past six years. I would just put those 2 things together and ask us to think about the sacrifices that our Gold Star families, the mothers, the fathers, the brothers and sisters, go through, that the sacrifice that their loved one made, the ultimate sacrifice on behalf of our nation. And think about our responsibility as individuals to them and those individuals that we've lost to continue to stay focused on the things we need to do to mitigate spread. Wear your mask, social distance, pay attention to what's going on around you. Go out and get tested. You may be one of those spreaders and you don't even know it. So again, I ask us on behalf of all those Gold Star families, and I want to send out on behalf of all the men and women of the National Guard and our families, our love and respect for our Gold Star families. Thank you.
Thank you, General. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. Question, Governor, about the stimulus package in Washington stalling out. I know a couple of months ago you were almost sure that that was going to come through. How much were you counting on that money coming through, and are there things that you won't be able to do because that money has not shown up yet? Will it cause any kind of budget crunch?
Oh, it won't cause any crunch whatsoever. You know, what we did is we took and ensured every possibility, you know, and so in doing so, you know, we're in great shape as far as, our unemployment situation from the standpoint of raising taxes on our businesses, that's not going to happen. From the standpoint of having having more money than we needed for our small businesses, more money than, well, an appropriate amount of money for our counties. We're able to shove money over into the ability to have, an insurance policy against PPE and/or testing. With our schools, we've got, additional monies in, even more additional monies there that can be available to us. And then we have also an incredible amount of dollars that came into the grant program, and they continue to come. Now, Paul, I still believe this. I do really believe that, I have become to believe that just maybe, in Washington is, calling it a swamp is a really kind word. It is just, it's unbelievable. It's just totally unbelievable how inept that parties and people are in being able to work with one another. It's just a crying shame. I mean, when it really boils right down to it. And yet everybody, everybody is a professional politician. What they want to do is throw mud here and say this and everything. And at the end of the day, what are they getting done? I mean, for crying out loud, this stimulus package should have been passed way back when. From the standpoint, I know personally that our president wants it to pass. I know that he's willing to bend and absolutely and to work on items that are still at play. But you know what's going to happen here, Paul, just as sure as I know my name? The closer we get to the election, the less likely this is going to become a reality and may ever become a reality. Everybody thought that this was going to get done before the House recessed and went home for Labor Day. And now everybody thought that this was going to happen before October the 1st, and it may. It still may. But from West Virginia's standpoint, we're in great shape. Just think about it. I'm meeting again with the Revenue Department again today at 4:15. I meet with them nearly every day. For a long time, we did meet every day. From the standpoint of West Virginia, you saw a start the year, boom, boom, 2 really super positive months, plus the fact that we finished last year with a surplus, which is unbelievable with the pandemic and moving the income taxes, income tax date to July the 15th. We've got a tremendous surplus of cash now in West Virginia, probably well in excess of $250 million of excess cash and everything from the standpoint of surplus cash, from the standpoint that it came in, it was really a 2020, deal from the income tax that got shifted into July. But we absolutely, got through 2020 even with a surplus. So we start July with a $44 million additional surplus. August comes in, I think, at 30 million or there close to it, additional surplus. The last report that I got from the revenue, the revenue people was September's looking halfway decent. And so from the standpoint, Paul, of we've got a lot of grant money still sitting there. We've got a lot of CARES money still sitting there. Our state's got a big surplus of cash. Honest to Pete, and we can say anything we want. But I'm telling you, from when the day I walked in the door to the day today, this state's rocking. And we're going to just keep going and keep going better and better.
All right, thank you, Paul. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is regarding the comments that General Hoyer just made about how quickly we keep reaching the next of these morbid milestones. Does that mean, given the fact that we keep increasing this rate, that we can just expect exponential deaths throughout the rest of the year? Do we see a cap to this? Thank you.
Well, it's Charles, is that correct? Okay, Charles, our medical team could probably comment on this better than I, but let me just say this. What's happened? What happened to us? Well, I mean, the number one thing that happened to us was just this. We had a lot of people travel out of state, primarily Myrtle Beach, and a lot of people brought stuff back. And when they brought stuff back, a lot of people brought stuff as staff or whatever it may be at nursing homes, and this, we know the magnitude of this killer. And honestly, if you open the door to a nursing home and introduce any level of COVID, it's going to race through that nursing home, and sure as I'm sitting here, you're going to have multiple deaths. The other thing, and we've forgotten this, you know, when was the last time someone said, and if you'll remember what I was saying over and over, probably now 2 months ago or a month and a half ago, this thing is absolutely raging in the south of this country. Florida, Texas, Louisiana, Alabama, Arizona, and then it crawled up to where Tennessee got pretty bad. And then all of a sudden, voila, it crawled right into Kentucky, and Kentucky got really bad. South Carolina was on fire. What happened? What happened? Really and truly, at the end of the day, this migrated just as we knew it was going to migrate, and it migrated right to us. We have known all along we're the oldest state, we're the sickest state. We've protected us as best we possibly could in every way possible, and still given us our lives to where we knew we had to be able to go to work and we had to do those things. Now, Paul, I hate it like crazy, and every day that I have to announce a death. But from the standpoint of where we've been through the summer and where we're going now into the fall, there's two ways you could look at this. A lot of the vacationing and everything is over, so things should begin to make improvements on that account. On the other account, we're doing what everybody wants to do, we should do, is go back to school. But in that, without any question, you raise the risk level. That's all there is to it. You raise the risk level to some degree. Now, in addition to that, in the fall, the flu season is going to raise the risk level even more. We've got to be absolutely on our game and continue to help and watch what we do in every way, or it's going to continue to be bad. Now, we're going to have to watch what we do in every way, but the only thing we've got to do is keep our eye on one thing, and that is this. If you do everything right, you follow the guidelines, I mean, we could shut this thing down in a second. If we all wore masks everywhere we go, absolutely, we could shut it down tomorrow. You know, we are trying to identify the spreaders by doing the additional testing. If we do the additional testing and we identify the spreaders, it's going to get better. If we absolutely stop the vacationing and going into places and bringing it back, it's going to get better. Without any question, if we can just bridge ourselves for a very short amount of time now, and we hope and pray it's in October. It won't be in October, in my opinion, but it will be very soon, in the next few months. And if we can make it that long, we're going to have a vaccine. So at the end of the day, that's it to me. It's just as simple as test, cut out the vacations where we're bringing this stuff home, and absolutely just get us some way to a vaccine. Now, that's what we got to do. Like it or not like it, that's what we got to do. We test, we find the spreaders, we stop that, we stop bringing this stuff home from other states, and absolutely identify the situations and then stop it. Stop it in its tracks and wait on that vaccine.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. As an aside, not my question, but Dr. Amjad had said we can check with local county departments about those single cases. The problem with that is, while many county health departments are very transparent, some are not as transparent and they don't release those numbers. So we'll have to find an answer for how to figure out, both for us and for parents, about those single cases, which won't be reported. But my question is, Governor, everything you've said so far in the briefing has led to this question. We have heard from sources, and we've talked with the Logan County Health Department, waiting for an answer from them. and maybe DHHR can confirm on the state level about contact tracing, finding out that one of the outbreaks in a nursing home, particularly one in Logan County, could be traced back to a healthcare provider. And a healthcare worker unknowingly had transferred that virus to the facility. So that being the case, if that does confirm to be true, a couple of things. What is the thought about testing West Virginia's healthcare workers all across the board, the ones on the front line? I'm talking about nurses and doctors who are directly involved with COVID treatment. Test everyone and then institute some random testing just to make sure they're okay. And also to incentivize these workers to get tested, because right now, if they test positive, say for Charleston Area Medical Center, they then have to use their personal time, their vacation time, and their sick time. And if that gets used up, they're penalized because they don't get paid. So is there any way to test these frontline workers? And then for the state, which you say is doing great financially and we're rolling, the state perhaps to step in with some special category to help those frontline workers financially if they test positive, and that way they're incentivized to be tested? Or can you talk with the healthcare providers to find some way that they could pay the healthcare providers who would test positive and have to miss work? Thank you.
Okay, Kenny. You've got a lot of questions here and maybe even ideas or whatever it may be, but let me say just this. As far as the state stepping up and the state stepping forward and doing and putting funds here and putting funds there to be able to help, well, we're doing it. For crying out loud, we're doing that nonstop. The state is rolling. The state can really go a whole lot better than it is now, you know, but it's doing terrific right now. And we want to continue to be able to put dollars in spots to make things better and better. We've done it. We've done it, and we continue to do it, and we'll continue to do it more and more. Now, as far as workers, I can't imagine that, I mean, I'll promise you, every healthcare worker on the front lines or on any lines, they absolutely want to know if they could possibly be asymptomatic, and they absolutely want to know without a doubt. You know, they're putting their lives on the line. You know, granted, we need to back them up and support them from the standpoint of, you know, if they had to take their sick days or whatever, or their leave days and everything, we've got to support them. And I'm all for support. I'm all for helping those heroes on the front lines. I'm all for it, okay? But at the same time, you know, Kenny, I know in my heart that there's no way that there's a first responder out there that feels like that they could possibly be positive and doesn't want to get tested. You know, so, you know, I just believe that the first part of your question, should we make it some way as easy as we possibly can and continually test all of our healthcare community, first responders and everything else? I'd love it. I'd love it. And if we have the resources and the ability, we've got the resources, but if we have the people and the abilities to be able to do that, I'm all in.
All right, thank you, Kenny. Next to David Beard with the Dominion Post.
Hi, David Beard. I have to ask a question on a different topic. It's one I tried to address yesterday, but I didn't get a response in time. Delegate Danielle Walker sent a letter to the governor's office on Wednesday raising some issues of some incidents that happened up here in this area. And she made two requests. One was to receive a call from the governor, and the other was to have those issues addressed publicly during a briefing. So I wanted to ask if a call might be forthcoming, and if there's any plan to discuss those issues publicly. Thanks.
David, I've done better than that. You know, we received the letter, and the first thing I did is yesterday I asked Colonel Cahill because you're talking about on one hand, you have a situation that is really a state police matter, but I asked Colonel Cahill to take care of this from the standpoint from the standpoint of a state police matter. He has sent a trooper to her, and I think that she's had a dialogue and everything in regard to that. And the other thing that I did was I also contacted the executive director of our West Virginia Human Rights Commission, and they have reached out to her as well. From my standpoint, I have done way more than just pick up the phone and just talk back and forth. I have taken action, and I absolutely sent the state police to run to the fire, and I sent the director of West Virginia Human Rights Commission to run to the fire. And the only other thing I would add is, whether it be either side, no matter what it be, we don't need to tolerate at any level of hate and hatred and hate speech and everything to go on anywhere at any time. But I don't know any more than I can do than just absolutely run to the fire and just do exactly what I've already done. I've sent the state police, and I've sent the West Virginia Human Rights Commission, the executive director there, and so hopefully those situations will be able to ease everybody's pain and everybody's minds.
All right, thank you, David. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Good afternoon. A lot of changes on that map today, a lot more green. So much of our conversation has been about its effect on school systems, but Dr. Marsh calls the map a public health map, which indicates that it should provide further guidance for the public. If the map is a public health map, then how should people use it for their decisions in daily life? If your county is gold, orange, or red, how should you use the map to guide you on regular activities such as dining out, going to church, attending a car show, or participating in a wedding? Can the map provide people guidance with those kinds of activities? Thanks.
I'm gonna let Dr. Marsh answer, but all I would say is this map is a great tool to guide you through the caution levels. Naturally, if my county were in the red, not only would my entire family would absolutely be very concerned. And so I think it's a great guide, but Dr. Marsh, maybe you could add a whole lot to this.
So thank you, Brad. I think that as the governor said, we certainly know that based on that color coding and the amount of COVID spread and activity by the two metrics that I alluded to early do give us insight about the level and the rate of community spread. But I think that's what's really important here. So the answer is yes, you can use it for that purpose. And we know that the more community spread, more likely you are going to be exposed to people with COVID or be exposed to the virus in your community. And we talked about avoiding the 3 C's, and the governor's talked about wearing masks and physically distancing and washing hands. But I think that the real key for us here is to understand that despite the color coding map giving us insight about the status of COVID in the community, COVID, as we've talked about, is a very ubiquitous, is a very common sort of, infection in all parts of our state, in all parts of our country, and all parts of our world. And so I think it's really important that people do feel happy and proud that they're moving those colors in the right direction by doing testing and doing the physical distancing and the mask wearing, the hand washing, and avoiding the 3 C's. But we shouldn't be complacent even if our county is in green, because a green color doesn't mean there's no COVID at all in your county. It means that spread is slowed down to the level that the number of new cases that you have on a daily average, or that positive testing that you have on a 7-day average or a 14-day average has reached a certain level that allows that color to be that way. But there's still COVID in the green counties, and there's still COVID in the yellow counties. There's still COVID in the gold counties. So we should constantly be aware and be protecting ourselves and others, because as the general said today, as the governor has read every press briefing, we're seeing too many people in our state die. And it is happening at a faster rate. And the way that we take care of that is we test and identify these people that spread, even if they spread without knowing. We wear our mask, we physically distance, we wash our hands, we avoid indoor places, we avoid crowds, and we avoid constant contact to people we don't live with as much as we possibly can. That's the way that we not only keep the map looking more yellow and green, but also that's the way we save lives and we protect each other and sustainably keep our schools open and do the things that we are all very committed to do in the safest, best way.
All right, thank you, Brad. Next to Matthew Young with the West Virginia Daily News.
Good afternoon, Matthew Young with the West Virginia Daily News. I just had a quick question about the Game Changer Virtual Summit that premiered earlier in the week. Has there been any type of analytic data that was recorded or possibly released regarding viewership? And also, are these summits something that are going to be continuing going forward into the future? Thank you.
I think that there's 4 scheduled right now. I think that's right and everything, but and they are going to be going forward. We're checking the numbers and everything, and we'll get you those numbers. I don't have the numbers, right now, so I can't report, on the viewership and everything. But what a program! I mean, really and truly, every piece of this puzzle, as far as drug abuse or any type of fallout from any type of drug situation in any way, we realize that very thing can cannibalize all of us, and it affects everybody. Rich, poor, black, white, Democrat, Republican, union, non-union, whatever. It touches us all. And so if that be the case, then we're all in. We're all in. Now, it's going to take Jim's Dream, Jobs and Hope. It's going to take communities and schools. It's going to take Game Changer. It's going to take every single thing in the toolbox to continue to absolutely try to combat this terrible, terrible killer. We know you got to have treatment, you got to have training, you got to have additional law enforcement, so many different things, follow up, all the different things, expungement, we know that. And we got that down pat and everything, but absolutely as we go forward, the Game Changers is going to really, really do exactly what their name is. It is a game changer, and especially for the people that can make the decisions to not get themselves into this mess, and that's our kids. So they're doing great work. I congratulate them.
All right, thank you, Matthew. Next to Mark Curtis with the Next Star Media.
Good afternoon, Governor and Cabinet members. Governor, I know you expressed your frustration at Washington for not providing another stimulus or CARES Act package. I'm wondering, I want to be clear on this, has the $100 additional supplement you were sending out in unemployment, is that program over that was matching with the $300 from FEMA? And if so, are there still monies from the original CARES Act in the state bank account where you could kickstart that and start giving out more money to the unemployed? I talked to a lot of people yesterday at the unemployment office, and they're waiting and waiting and waiting for more benefits, and they really can't wait for Congress to get off its,
Mark, I do know. Believe me, B, I do know, and I know exactly what they ought to get off of. And but from the standpoint of I guess right now, everybody is somewhat paralyzed and sidelined because for the state to step in and do the entire heavy lift. Well, to be perfectly honest, it would drain our dollars so fast it would be unbelievable. And so, from the standpoint of what we have sent out thus far in the state of West Virginia, we have sent out in excess of $1.5 billion. It's amazing the amount of dollars that have been sent out. But Congress will surely, to God above, they will get off their you-know-what, and they will get something done to be able to assist and help these people. And if the state can then, help in their way, the state, if need be, will continue to do so. But Mark, it's terribly frustrating, and I just hate it in every way, because every single thing that goes on, everything in Washington has got some political, scheme behind it all. Well, what is wrong with us? What in the world is wrong with us in this country? You see, that's the very thing that I get the most upset about, on these briefings, is when somebody is out doing something and casting stones or whatever, purposely from the standpoint of some political gain. I mean, for God's sakes, people are dying. Do you know how painful it would be? And many already know, to stand there and look at your loved one trying to breathe. I mean, just gasping for breath, and we're going to go out and absolutely play some political game all the time, with people's lives on the line. I just can't stand it. I can't stand it. And, like I've said so many times, I really could care less if you're a politician. I mean, if you're an independent or a Republican, a Democrat. All I want us to do in West Virginia is to be West Virginians. And absolutely, granted, we have maybe somewhat different values, but at the same time, for crying out loud, West Virginians are good people, good people. And we surely don't need to adopt Washington's ways. It's terrible. It's just no good.
All right, thank you, Mark. Last question today comes from Katie Coyne with the Charleston Gazette-Mail.
Hey, Governor, following a little bit off what Brad asked, and in response, you said that if your county were red, you and your entire family would be strongly concerned. Right now, is there any mechanism on the books currently that would allow counties with higher rates of COVID-19 that would be in the red or around that area to issue their own guidelines to mitigate the spread, like closing businesses in the county, making their own sort of implementations for the policies that we have on books? And if there isn't something like that, why not? If we're saying that this virus is different in every county and we're tracking it that way, why not put something in place to allow counties to have that power?
And it's Taylor, is that correct?
Katie. No, Katie Coyne.
Katie, I'm sorry. Forgive me, Katie. Katie, here's the whole situation. We take tons of input and everything from the local health departments and everybody else. And the local health departments have a lot of control and a lot of authority and everything. But there's also this to contend with too. If we get 55 counties doing 55 different things, we end up fragmented all over the place and everything. I promise you with all my soul that we're trying to do everything we possibly can in working with the local people to be able to make the right moves in each one of these individual counties. From the standpoint of schools, the superintendents are making all the calls on how they're going back to school, and whether it be virtual or it be, a hybrid, or it be, in classroom. But with all that being said, I can assure you that we're watching. I mean, this is not like we're just sitting back and saying, oh, that county up there's red, wonder what they're doing and whatever. I mean, that's the last thing on the planet that's going on here. So you got a lot of people that we're watching. We're on our game right now. And right now, thank goodness we don't have a red county, and we're going to hope and pray. We're just going to keep on adding more yellow and adding a little bit of orange, and then before you know it, we're going to be green. And let's just try to hope and pray it goes that way.
All right, thank you, Katie. Governor, back to you.
I really don't have hardly anything to report, other than, to summarize from what we've done. I congratulate West Virginia so much on being, second in the nation in personal income growth, and that's really great. But at the same time, I am very concerned and sympathetic about all those that are out there still hurting, and I'm not going to let you down there. That's just all there is to it. Now, but with all that being said, I think about this. I've said over and over, I'm not Reverend Jim, but at the same time, I'm a Christian and I'm proud of it, and I'm not ashamed to talk about it. But from the standpoint of just this today, when I was at the house, early this morning and everything, John Rich came on. He's got a new song out, and it's called Earth to God. And he sang that song, and I was listening in every way. But really, when it really boils down to this pandemic, nobody's got the perfect answer that's here. But there is one that is in control. And he expects us to keep digging and keep climbing that mountain and doing all the stuff that we're doing in life. And so as we keep digging, if we'll keep doing that, just like, I was telling you, I guess, day before yesterday, that the Bible clearly says, that we really can't quite imagine how many people are really back there and are really watching us as examples to see just that we're going to keep going up that mountain and keep digging. Well, in his song, he basically was just saying, God, please hear us, as I know without any doubt he does. And God, please, please guide us through this, as I know without any doubt he will. And so to all West Virginians out there, I want you to know that I don't have all the answers by any stretch of the imagination. No, nor does Superintendent Birch, who's sitting right here with me, or Dr. Marsh, or any of the other panel, any of the other people, whether it be General Hoyer, Dr. Amjad, Secretary Crouch, whomever it may be. We don't have the right and all the answers in this. It is a very difficult juggling act, but there's somebody that does. And so I asked you to keep all of us, not only this nation, not only West Virginia, the entire world, in your prayers. What a wonderful song, and what a wonderful timing for that song. So nevertheless, that's what I'll leave you with. I'll leave you with just this. There is someone surely in charge, and it's really not us in this. We'll get through this. Keep everybody in your prayers. Thank you so much.